Welcome. We are a mother-daughter podcast about all things surrogacy. Together, we have brought 8 beautiful babies into this world, and we would like to share through education and knowledge about surrogacy with those who want to educate themselves on the topic. This is Stop.Sit.Surrogate. Have you ever thought about growing your family but aren't sure what your options are? Or maybe you're someone who wants to help others experience the joy of parenthood? That's where Northwest Surrogacy Center comes in. Northwest Surrogacy Center is a full-service surrogacy agency that guides intended parents and surrogates through every step of the journey, with compassion, transparency, and personalized care. From matching to legal support to emotional wellness, they make what can feel overwhelming feel deeply human and supported. Whether you're considering surrogacy to grow your family or you're ready to become a surrogate yourself, Northwest Surrogacy Center is there to walk beside you every step of the way. Visit northwestsurrogacycenter.com. That's nwsurrogacycenter.com to learn more and take the first step towards something truly life-changing. Northwest Surrogacy Center. Love makes families. Surrogacy makes babies.
Hey, everybody. Welcome back to Stop.Sit.Surrogate with Kennedy and Ellen. We have a very interesting and exciting guest today, and we're going to let her introduce herself. So go ahead and take it away.
Thanks, Ellen.
You're
Hi,
welcome.
I'm Jana. I'm a psychologist in Portland, Oregon. I've been a therapist for over 10 years. I specialize in perinatal mood and anxiety disorders, among other things. And I also happen to be a surrogate. And as part of my work, I offer something that I just call it Carried with Care, just to kind of distinguish it from my regular practice. And that's where I specifically support surrogates through their journey.
Wow. Very cool.
This is very cool. Goodness. Okay. So what was the first word you said? What?
Perinatal mood and anxiety disorders. So that's everything related to pregnancy, postpartum, that experience. So when people maybe never had a mental health disorder, but then in pregnancy, they get really anxious, or, postpartum, they develop symptoms of depression, that kind of thing.
Oh, wow. Did not know that was the thing.
Has that always been a focus of your practice, or is it something you kind of morphed into? Because it's very specific.
Yeah. So, I mean, it is only one of the things that I do. To be fair, I also work with people who have generalized anxiety disorder or have trauma, among other things, but it's something that I really love doing. In Oregon, we have a nonprofit called Baby Blues Connection, and they specifically work with parents postpartum. And so I volunteered with them for a long time and got some additional training around that topic. And so, I just really like working with pregnant people and postpartum parents. So
it's so needed, because you don't realize that you think you're crazy. And I hate to use that word as so, loosely, but you do. Like, I was way different in my pregnancies, all of them, than I was as a human, like just normal.
Just like a human.
Like just as a normal person without all those
pregnant.
hormones and all that stress, especially when you're carrying a baby for somebody else. Like
100%.
Right?
That adds like a layer.
Yeah.
For sure.
A lot of pressure.
Chicken or the egg? Which one came first? Surrogacy or this? Or
Oh no, this came much earlier. I actually, I always knew about surrogacy, but it just really wasn't something I was thinking about. Like, I had, just like you, I also watched Friends as a, as a youngling. And also actually knew somebody in my personal life who was a surrogate, but it just didn't really register at all. And then when I started working with people who are struggling with infertility, or I had friends going through IVF, at that point, after I already had my kid and after I already decided that I was done having children for myself, that's when I met someone who was a surrogate, and things sort of fell into place. So so that's the chicken and the egg answer.
Wow, that's pretty cool.
Yeah.
So did you, correct me, so did you meet them through your practice?
The surrogate? No, that was a friend of a friend that I met at a picnic.
Oh my gosh.
Meant to be.
Yeah. Oh, wow.
That's a meant meeting. Yeah.
So then how did you navigate it? Did you try and do independent?
No, I went through an agency.
Okay.
Yeah, we have an agency. Am I allowed to say the name of the
Yeah, of course
agency?
you are.
Yep.
It's Northwest Surrogacy Center. I think
Oh,
they're amazing.
yeah.
Hmm.
And yeah, very quickly decided that I wanted to go with them because I really like how they work with men having babies and
Yep.
they're just doing really good work. They give a lot back to the community and I really like
Was
them.
that
So
was that agency recommended to you per se, maybe from this surrogate friend, or did you just research?
yeah, that's the agency that she
Yeah,
used.
good.
Hmm.
Oh, how very cool.
Yeah.
Okay. So you um when did this all start?
The surrogate?
Yeah, the
Surrogate?
surrogacy.
Um, Let me think back. I want to say in December 2023 is when I first reached
Oh,
out, but then it might actually have been December 2022.
Okay.
Because then I knew that I had a bunch of travel planned for the summer of 2023. Yeah, that seems correct. Um, and so they said, let's pause until you're done with all your adventures and all your traveling and then talk again when you're back. And
okay.
so like September 2023 is when we kind of pursued this more seriously and kind of went through all the
This is
steps.
new. The baby must be little.
Baby is 6 months.
Yeah,
Yeah.
there you go.
Uh-huh.
Wow.
Oh my
Hmm.
gosh.
Like you just had a baby 6 months ago.
I
Gosh,
know. Oh my gosh.
happening.
That's
Okay.
very
Yeah.
cool. So
Okay.
then it all moved very quickly. Like going once you were ready after travel, it seems like because
Hmm.
that was you said September of 2023. So we're
Yeah.
in
And
August of
baby's
25.
Yeah, so
yeah, that was fast.
I had my first transfer in, I want to say March or April of 2024.
Yeah.
Okay.
Man, times are hard.
Right? No,
Right.
that
With
would be right.
math.
That
Yeah.
would be
But
right.
no,
Yeah.
yeah.
Yeah, and that one didn't take, and
Okay.
that was really hard because then
Yep.
you start doubting yourself, and you're like,
Yeah.
what if I can't do this? What if this
Right?
isn't
Yeah.
working?
Uh,
Um, yeah, but then the second transfer a couple months later took, and then
Excellent.
it was smooth sailing from there.
Wow, yay. And
so
each
when
time just one embryo?
Just one embryo. Yeah,
and when you
yeah.
say smooth sailing, what was your pregnancy with your own child different than your surrogate pregnancy or pretty mirrored?
No, they were both super easy, straightforward, no complications, no
Wonderful.
diabetes, no high blood pressure, nothing.
That's
Everything was
great.
super smooth. Yeah.
And you mentioned that you got to the hospital and 2 minutes. Like what was that? That what
But why are you jumping
Yeah.
so? Oh, okay.
jumping, but we want to talk about her
Yes.
practice too. I
Okay.
Yeah.
just if she said
No,
everything went great.
Ellen knows things that you don't know, maybe. So um, let's see. So I was in labor for quite a long time, but I
Okay.
wasn't really sure if this was really it or if this was just sort of, practice, Braxton Hicks, that kind of
Right.
thing.
Right.
Because I had even like I still had like a midwifery appointment the morning that I had contractions. She's like, "Oh, we don't know yet. Can't
Oh,
really tell." And so I
okay.
was like, "Oh, this may not really be the thing just
Okay.
yet." And
How
so
far along were you at that point?
so I was already 41 weeks and one day. So,
Wow. Okay. Yeah.
pretty
Yeah.
going a little late.
Yeah.
But
Oh. And they
um
weren't gonna induce you?
So they did pressure me to pick an induction date, which is one of the things that was the hardest things about
Yeah.
this journey that I felt kind of coerced and pressured into picking a date.
Mm.
But there wasn't any medical reason to, they're
Okay.
like, it's,
Right.
yeah, your due date and it's
Mm.
IVF and all of those things, but there weren't any actual complications. Like we did BPPs like twice a week, like the biophysio profile,
Yeah.
Okay.
and everything was fine. Like
Yeah.
placenta was working just great, and
Good.
baby was fine, and all of those things. So I didn't feel like they had a really
Good
strong
reason. Yeah.
case, but
Right.
I still kind of let myself be talked into picking an induction date. And NDIPs agreed with that. And so
Okay.
that was really hard because
Okay.
I was like, but I don't want this
Yeah.
and they want this. And so kind of that dynamic of like, hey, it's their baby, but it's also my experience and my body and that kind of thing. So
Yeah.
that was probably the hardest thing. And that was one of the things that I felt like, okay, there should be some support available for somebody trying to navigate this. Because
Yes.
even if you're used to working with, pregnant people preparing for birth and helping them advocate with medical providers and that sort of thing, which therapists do.
Yeah.
But it's like how they don't necessarily know how to support you when the dynamic has that like extra layer of it's not your baby and whose guidance, and maybe there's a contract that specifies what you need to do. And, maybe you signed the contract when you didn't know what you didn't know. Like
Right.
Yeah, I feel like I'm losing my train of thought. Like, what question am I trying to answer?
Oh, you're good. You're great.
About the induction part. So was it in your contract that if you got to a certain point, you'd have to induce? No.
No, it just says something like following doctor's guidance.
Yeah.
But it's like, okay,
It's to be interpretive.
yeah, exactly. It's kind of vague wording.
Yeah.
So, but luckily, and this is where I really feel like I was fortunate. She came before the scheduled induction, so we actually avoided the whole shebang. Yeah, but so then I don't know if they told you guys this, but I got the guidance of like wait till your contractions are 5-1-1. So like, 5 minutes apart, 1 minute long for 1 hour. And that's when you go to the hospital.
Okay.
But that just never really happened. They just were all over the place. Sometimes they were much closer together than they were like, a half an hour apart. And so I was like, I don't really know what to do. And so by the time that I was like, okay, I think we should go to the hospital. We got to the hospital and 2 minutes later she was out. Like there was no midwife in the room, no doctor in the room. It was just a triage nurse who was completely overwhelmed.
Oh my gosh.
Didn't know what was happening.
Oh my gosh.
So you weren't even to maternity ward.
So we just went up. We went in, up the elevator, out the elevator, and then baby was born.
Was anyone with you as support?
So magically, my doula arrived at the hospital like right as we were walking through the door. So she was there, and that was just perfect timing, and it was magical.
Great.
Yeah.
Were the IPs there for the birth?
No, they missed it just because it happened so quickly. Exactly. I did text them and call them saying like we're going to go to the hospital.
Not thinking it would
but at that point I didn't, I was like, oh, this could be hours.
Right.
Who knows? Take your time, take a shower, eat breakfast, do what you need to do.
Right.
And so so that was a little unexpected, but great.
Yeah.
and I'm not gonna lie, I actually really appreciated that I had a couple minutes before they got there, and that I got to be the one to hand them the baby. That was really special too.
Yes.
So I'm not mad about how things
happen. Everything happens for a reason.
For a reason. Yeah. No, that sounds like it was incredibly
peaceful,
wonderful and beautiful. Yeah, it does.
Yeah.
That's awesome.
Yeah.
And you were okay, like no tearing or anything like that? You didn't have any complications because it was so fast?
I did have some tearing because the birth was so fast, and they also did need to, that's probably the worst part of the whole birth experience. They had to like basically stick their hand in my uterus and scrape the
placenta. It happens so much with IVF.
I don't like this. I've done it 3 times. I haven't had to do it. Don't ever want to do it.
And you're not medicated, right?
No, you're definitely not medicated. You're
not medicated. All the way up to the elbow, and you're like, "Excuse me, yeah."
Well, and they weren't even telling me what was happening in the moment, because they're like, "Oh, we just need to do this, and we'll explain everything later."
What?
No.
Were you screaming, like in pain?
No. I mean, it was not pleasant, but I don't know. For some reason it was fine.
Yeah, they were successful then. You didn't have to go to surgery to get it removed. Okay,
no, it was all good. And honestly, because they did that, like postpartum bleeding was pretty minimal because they had gotten everything out. And it was and they did a good job. with stitching me up. So everything was pretty smooth.
Excellent. Excellent.
Crazy.
So we're just always curious sometimes, and then we'll go on. But in the hospital, are you given your own room and IP's given their own room?
Okay. Yeah, we had rooms that were not exactly next to each other, but almost. So I think they were like one room over.
Okay.
Yeah.
Nice.
Did you,
and they came.
Oh, sorry. No, they came. Go ahead.
No, I was gonna say they came over to let her like nurse while they were in the hospital. So that was really special. Yeah, and then once they left, then I tried pumping, which wasn't that successful because I think you've talked about this with other people on the podcast, but I feel like sometimes when your body just knows there's no baby there, your body's like, I don't really,
why would I do this?
No, why would I do this?
Yeah.
So so didn't really make enough milk for her.
Okay.
And emotionally that was pretty hard too, because I was like, but I really want to do this for her.
Right.
Yeah, but eventually I was like, it is what it is. I tried, and this is where we're at.
Yeah.
All right. So is that the only time that they so were you and baby there for the same amount of time? Because I'm just trying to like picture, like, did you see baby at all, or was it just like to come over to nurse?
I mean, they hung out with me.
Oh, okay.
Yeah, but usually, when they're like, oh, maybe she's ready to eat or whatever, like then I also nurse her.
Got it. Okay.
Yeah. No, we're pretty good friends. We're actually going to see them Labor Day weekend, so I'm excited about that.
How fun.
Yeah.
Is that the first time you'll see her since she was born?
Yeah. They live probably not too far from you guys, somewhere in California. So so my son and I are gonna fly to hang out for the long weekend and see them.
How old was your son when this took place?
He's 9. So
he gets it. Yeah.
He's as old as yours.
Yes, he is. Yes, he is. Oh my gosh, mine doesn't remember the other.
You don't have to answer if you don't want to, but was he totally okay with it? Like
he's totally cool. Like he loves that we're getting to help, other people, and he's excited. And he what I was excited about was that because it went so quickly, like he actually got to see it. He got to see her be born. And I don't think that he really cares one way or another, but I'm like, I think that's kind of cool. Like, when do you ever see a baby being born?
That's cool.
Oh, wow. So he was in the room.
Whoa.
Yeah, because he was,
so fast.
He
was with you. He came with you.
Yeah, he came with me.
Oh my gosh. I think mine would be like, where are my video games? Like, I just want to go play the video games.
He did have books with him, but but I don't know. I mean, it's not like he had to pay attention for hours.
Yeah, no, for sure. When it went so quick, he was probably just like being rushed into a corner or whatever it was.
He was like, what is happening?
Yeah, baby's here. How'd that happen?
Yeah.
Yeah. Oh, how cool though. That is very cool. That's a fun experience to experience together.
Yeah, I think so.
So I'm curious. So because you help surrogates and you help women in these difficult times during pregnancy, did you need that service? Did you feel that you needed to talk to somebody during that, or?
Yeah, so I didn't see a therapist, even though I could have. I know how to access care, like I know how to navigate the system, which isn't always true for people, right?
True.
So I could have, but I feel like, and my agency, and shout out to my case manager, Amber, she's amazing. So I had a really great case manager. I did go to in-person meetups. I, connected with other surrogates in like Facebook groups that were, what is the word? Like the agency has like their own Facebook group for surrogates and stuff. So all of that's great. But there were definitely like times where I felt like it would have been nice to have somebody with like clinical knowledge or clinical experience that could support you in a way that is not just the more, do you see these lines on the pregnancy test too? Or, or did you all eat fries after the transfer and things like that, without it needing to be like like a medically necessary thing, you know? So obviously when you have something traumatic happen or a miscarriage or a traumatic birth or something, then you might qualify for a medical diagnosis. And then everybody's like, yeah, sure, go see a therapist. But if you're actually like, you're fine, you don't have a diagnosis, you just want to talk about those boundaries, like, how do I navigate this? Or yeah, like, how do I make sense of maybe these feelings? Like, does it make me a bad person if I feel this way? Or, you know, that kind of thing. And then also having a confidential space, there's probably questions that you can talk about with other surrogates in those like in-person meetups. But that's not really confidential. And what are the implications if somebody finds out? What if you want to do another journey and somebody finds out that you felt more anxious than you know, like those kinds of things. So yeah, so I feel like there's that in between that's kind of missing, where you can say, I feel really resentful right now, or I feel anxious, or you know, and you're getting more than just like, oh yeah, that's tough, and maybe next time change it in your contract.
Right. And you're given the safe space to do it and not be judged.
Yeah.
Like, because a lot of us had those
Yes.
feelings and we had no idea what to do with them.
Yes.
And we rant and raved to the people in our home, and you're like, what, huh? Yeah. Or you keep it all bottled in, right? And that's not good.
Exactly.
Thinking about becoming a surrogate, it's a life-changing decision, and you deserve expert guidance every step of the way. That's where Serene Surrogacy Partners comes in. Serene Surrogacy Partners is a reputable, experienced surrogacy agency dedicated to supporting women like you with thorough screening, legal protection, and comprehensive medical and emotional care. As a surrogate, you'll be matched with intended parents who align with your values, and you'll have a dedicated case manager throughout the journey. Compensation is fair and transparent, and your health and well-being always come first. If you've ever considered surrogacy, start by getting the facts. Visit serenesurrogacypartners.com to learn more or apply confidentially. That's serenesurrogacypartners.com.
And then I feel like even when you do access therapy with you know, a psychologist or a social worker or something like that, they're people, and sometimes they have their own biases around surrogacy too. And they're not going to say that out loud, obviously, but you know, sometimes I think, and the reason why I know that is because I obviously have a pretty big network of fellow therapists, and you know, I heard things that they would say, and I'm like, okay, so there's some judgment there, and I don't think that's the best place to get support.
Yeah, I agree.
Agreed.
Very interesting.
Wow. I just have so many, but I don't know how to put it into a, let's see. So how does somebody get to you? How do they find you? I mean, I know you have the website and everything, but I wouldn't have known to gone there, right? I wouldn't have known.
Yeah, that, I mean, honestly, because this is a fairly new thing that I'm doing, it's been a little bit hard to get the word out, just because, you know, a lot of groups have rules against like promoting your business and stuff like that. So I am hoping that I might actually be able to work with my agency in the future and kind of partner in some way. But right now it's mostly word of mouth and coming on a podcast like yours.
Okay. Yeah.
I am curious. Okay, so say the fun word again. The pre
like perinatal mood and anxiety disorders.
Literally, you're just gonna have to say that the whole podcast because I couldn't say that to save my life. So that, does somebody get diagnosed with that, or does somebody find how does somebody know they have that?
Yeah, you can get diagnosed with it. There's, you know, usually I think most OB offices now screen people for that. You know, like I don't know if when you were pregnant, if you got questionnaires from your OB, like at
like the normal, like, are you depressed, or like, do you
exactly. So
like,
they use those kind of screening questionnaires, and that kind of gives them a good indication, like if you have a specific score that like you might want to you know, get referred, that kind of thing. Yeah. But the nice thing with this is that you don't need a diagnosis, right? Like you need a diagnosis if you go through like if you want to use your insurance and that sort of thing. But most agencies have either mental health benefits or like a wellness package that is broader. And so the idea is that, again, for a variety of reasons, you may not want to have a diagnosis in your records. You may just want to have somebody that you can talk to in a confidential space who gets it and who still has that clinical expertise.
Yes.
And so, yeah, if you use those benefits, like you won't need a diagnosis.
Okay. So now I have another question.
Mm-hmm.
Can you maybe list off some like symptoms? Like Dr. Google sucks. I'm just gonna say that right now. It's gonna tell you that like you're dying when you have like, a headache. Like it's the worst. So if I'm feeling, because people are often told, oh, it's the baby blues. And I know that that's an after thing, right? There's postpartum depression and there's baby blues that happen after. But during, how do you know it's not just, oh, I'm just feeling run down?
I mean, honestly, it's a lot of the same symptoms that you would have if you had major depressive disorder, generalized anxiety disorder. So that could be like increased irritability, or you have difficulty falling asleep. Maybe you have racing thoughts. Maybe you have intrusive thoughts. Do you know what intrusive thoughts are? Is that like a term that you're familiar with?
Oh yeah, like bad thoughts.
Yeah,
bad thoughts.
Yeah,
harm myself,
exactly.
harm others, blah blah blah. Yeah.
Yeah, kind of like imagining the worst things happening, but you're kind of involved in having those things happen. Yeah. So, things like that. Or you just don't find the things that you normally find enjoyable. They're just not enjoyable anymore. Or you do have thoughts of like wanting to hurt yourself or suicide. Obviously that doesn't happen to everyone. Also with symptoms, you don't have to have every symptom to have, like a clinically relevant experience. Like you may just have 2 symptoms or 3 symptoms, and that's still meaningful or still matters. Also, if you have a history of depression or anxiety, you're at higher risk of having it in pregnancy or postpartum as well. So usually providers will have a little flag in your records and kind of maybe keep an eye out and be more on guard for that. But
so what is a typical, if someone does want to come and speak with you and they're just like, I just need to get this out and talk to somebody, what's a typical amount of time somebody would come to you? Just because I know you have a package of like 10, but then you have individuals. Like
because it might just be one time, right? It might just be like, can we just talk through this one specific scenario and get some either coping tools or maybe some like communication strategies, or actually just have the space to process any of these things. Now, if somebody does have a more traumatic and it doesn't even have to be traumatic, a more serious situation, let's say, they may want to come more than a couple times,
But it's acceptable. Like if somebody really just wants to come one time and they want to use some of their wellness benefits as a surrogate through their agency and through their package, they're allowed. They can come. It's acceptable.
Absolutely.
Yeah. Great.
Absolutely.
That's nice to know, because some people really just want to go through one scenario. Like this is happening. Like, let's say you didn't want to be induced. IPs wanted you, but like,
exactly.
Let's work through that. It's almost the end of the pregnancy. Let's just work through it.
Exactly.
Do you see people from all states, or does your license only allow Portland, Oregon?
So unfortunately, like I wish I could say, oh, anyone can do this. And I was exploring different options of maybe doing this more like a separate like coaching business, which coaching doesn't have the same licensure requirements, and so it's not, it doesn't have the same laws around it. And but the thing is, if you offer anything remotely like therapy, it's also like you have to follow the ethics and the licensure stuff. And so currently I'm licensed in Oregon and in Washington. And so those are the states that surrogates can can be in to see
Surrogates need
me.
to reside in those states, right?
They need to be physically located in them. You
Okay.
could be a resident of California,
Okay.
but if you're currently in Oregon, you can come
Ah,
and talk to me.
okay.
Um,
That's interesting. Okay. I
Interesting.
like that.
mhm.
Okay.
Very interesting.
Yeah.
Yeah. And you
Yeah.
do everything Zoom, right? Is that what
I
it
mean,
does?
if you're in the neighborhood, you're welcome to come to my in-person office.
I love
Okay.
that.
But yeah, telehealth works really
Yeah,
well.
telehealth is a beautiful thing that came out of COVID. I'm just very happy with it.
Oh yeah, seriously.
Yeah.
Hello,
But it's so
podcast.
nice.
Yeah. Okay, so I am curious. Just because it's so that word is so one, it's fun to say, but two, it's
I think
just
it's a
so
bunch of words.
I know, but but a term. Let me say term. Sorry, in my
Phrase.
head it like all went
Okay.
together.
Phrase.
Whatever.
Okay.
Um, but no, shoot, Ellen, you made me lose my train of thought.
The phrase, the terminology.
Yeah.
What about it?
I don't know now.
Oh
Had too many babies.
my
It's
gosh.
it's flown away. Oh no, okay, here's this. If say I have anxiety, I have and I'm just being honest because I don't know, right? So like I'm pregnant, I have anxiety or I have some type of depression. I'm currently seeing my personal therapist who does
Uh-huh.
not, you know,
Specialized.
specialize in this.
Hmm.
Am I going to get what is how what is the benefit of going to somebody who specializes in this versus because I feel like my therapist would just be like, well, you're depressed. Like, let's walk through the depression. So I think I already know the answer to my own question, right? Because they're going to kind of look at it more so as like, well, it's just baseline depression, not take
Uh-huh.
everything into consideration, right?
Yeah, sometimes it can be tricky because if you have pre-existing depression or anxiety,
Hmm.
it's sort of does pregnancy just exacerbate that, or do you have something
Mm.
unique in addition or
Right.
separate from that, right? And so sometimes that just I mean, there's no one size fits all answer, or there's no
For sure.
good easy answer to tell you like which is it.
Yeah.
Um,
Bummer.
um, yeah, I know.
If only.
But I think the benefit is just that that you get to talk to somebody who
Gets it.
maybe has more
Understand.
nuanced
Yeah.
understanding of
Yeah.
the experience.
Right.
And then while I definitely don't think that a therapist has to have personal experience in anything that their clients go through, like we wouldn't have any therapists if that was the
Right.
case.
True.
I do think it doesn't hurt, right? So
Yeah.
I kind of liken it to I'm sure you've had like friends who were not yet parents sharing opinions on parenting, and
Right.
then they become parents and they're like, oh,
Right.
Yep.
I
Right.
get it, I understand.
Yep.
Um, and so I feel
100%.
like that
Yes.
that's true for this topic as well. Like,
Okay. Yeah. No, that would make a bunch of sense. It's a bummer that it's hard to differentiate. That is a bummer
And everything is confidential, right? Because it's
yes,
client therapist privileged, right? It's so
yes,
this doesn't go back
to the
because I think
agency.
some people, let's say they want to do another journey when they're done with this one, and this one's
Oh,
just been
right.
particularly hard. A lot of anxiety, and normally they're just a very calm person. Just all kinds of things, can happen. So I just want people to realize that you can talk to somebody. And mental health is not a stigma anymore. Like you can, and it's not gonna bite you in the butt, for heaven's
right.
sakes, for the
And so
next journey.
right, but I also want to clarify if somebody comes to see me and they very clearly have like meet criteria for a diagnosis, I
Yes.
will absolutely discuss that with them and
Okay.
then probably document it because that
Right.
would be unethical not to do so.
Absolutely. Yes.
Um, but I guess what I'm trying to say is that there are a million reasons why somebody might want to talk to a professional without having or needing a diagnosis, right? Like
Right.
Yes.
for
Yes.
all of those things.
Yes.
Yeah.
100%.
Yes.
Right.
Okay.
Once
But
that
yeah,
diagnosis is there, it's there.
yeah. But I think that unless you are currently on medication,
Hmm.
it doesn't necessarily preclude you from another
Another journey.
journey
Okay.
Right.
Okay.
either.
Right. Right.
Um,
Right. Good.
but still, right? Like sometimes you're like, I don't know. It's kind of like pilots or what's like another where like they're not going to seek mental health
Right, because they're
services
afraid.
because
Right.
they're afraid they're going to be barred from flying, that
Exactly.
sort
And
of
that's
thing.
their livelihood. And I'm not saying
Right.
surrogacy is a livelihood. I'm just saying once
No,
you
but
have a
I
stamp,
do feel
But
like that
yeah.
happens with surrogates where they're like, I better not say that I'm struggling because
right.
what does
Right.
And
Because
mm-hmm.
if
then what
they
is that? Yeah.
did say they were struggling or just needed to talk to somebody, and like you said, could get it literally in 1 or 2 sessions, and they could breathe a peace of mind and be able to finish that journey
Yeah.
more in self,
Mm-hmm.
like more power
Because
to them.
And a
I'm
lot of the times when, I
yeah.
mean, I'm just assuming. I'm just gonna say I'm assuming here. But I feel like a lot of the times when surrogates do get overwhelmed or they do want to talk to somebody and they don't speak up, obviously we know why, because they're afraid to, which I don't blame them. Um, because I've felt that way myself as well.
But that's a
But
stigma that we're trying to.
no, I know, and
Yeah.
that's right. That's what I'm saying. And Ellen, every time you
Oh,
jump in, I forget
sorry.
everything. Sorry, I'm sorry. I'm sorry. I'm sorry.
It's coming. It's
Whatever.
coming.
It's whatever. I'll remember in like an
It's coming.
hour.
It's coming. No, you won't. You remembered in 5 seconds last time. Okay. Okay. Okay.
Yeah.
Okay. So, how do people get you? How website, Instagram? What? How can people find you?
So for my own mental health, I try to avoid all the social
Okay.
media things as much as I can. But my website sounds a little clunky. There's a lot of dashes, but I'll just say it. It's www.heart-mind-therapy.com. That's like my main practice, and then /carried-with-care.
Okay, it'll be in the show notes. Don't even worry about it. It'll be in the
Yeah.
show notes.
Perfect.
I remember what I was gonna say. All right, rewind. Okay. Um, a lot of surrogates, right, they're afraid to come forward because we're afraid of the stigma and everything like that. But oftentimes our anxiety or our depression really doesn't have to do with the pregnancy. It has to do with the overwhelming feelings of, and I'm just assuming here, I'm just assuming
Mhm.
for the majority, but it has to do with the overwhelming things of like, oh my gosh, okay, like I'm not able to keep up as much, or I'm not able to do this, or something's happening in my life because life goes on and like things happen in life. So right. It should not scare people to talk about it because mental health is such a big thing now and it's totally fair and it's totally reasonable. And
Right.
like I think everybody should. I think when you're born,
Yeah.
you should just be assigned a therapist. Like I just think that that's how it should
That
work.
would be amazing.
Like a little life coach for your whole life. How amazing. But it
Yeah.
it is more times than not, I would assume it's not anything related to do with the baby or being a surrogate in itself.
It could,
Mhm.
right?
Yeah,
Like I think
right,
what
it
you're
could.
saying is absolutely true, but I think often it's also that people underestimate how responsible you feel for things going well. Like maybe you didn't feel all that anxious with your own pregnancies, but
Right.
then with this it's like, oh no, did I eat well today? Or yeah, I don't know. There's
Right.
just this
No.
this
Yeah.
layer of pressure and this
Yes.
anxiety that it and or IVF and surrogacy pregnancies have a lot of subchorionic
Yes. Oh,
hematoma
hematomas.
Hematomas.
and,
Yeah.
and that
Yes.
kind of thing. And so then, you're bleeding and all of a sudden you're like, oh no, is this something I did? And
Right.
what
Right.
happens if something happens? Am I going to be blamed? Am I to blame? Am I responsible?
Right.
How do I, or then even, my example, if I had pushed to say, no, I'm just not going to agree to the induction, which I could do, right?
Yeah.
Legally, I have that right to refuse
Of course. Yep.
intervention that I don't want. But then, God forbid, let's say something had happened. Like,
Right.
how would I ever be okay?
Right.
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 That kind of thing. So how do you, how do you make those decisions? How do you navigate that?
Right.
It's a stress
For sure.
that I don't think other pregnant people can even relate to.
Yeah, not people that have babies for themselves.
Right.
Like, yeah,
Mm-hmm.
it's a very different. It's it is it's very different. It is very different.
We'll be right back. But first, I want to take a quick moment to talk about something close to my heart: helping families grow through surrogacy. If you've ever thought about becoming a surrogate, or if you're an intended parent ready to start your journey, Paying It Forward Surrogacy is here to guide you every step of the way. At Paying It Forward Surrogacy, you're not just a number. You're supported, celebrated, and connected with real people who've walked this path before. Whether you're just starting to explore or ready to take the next step, they'll make sure you feel informed, empowered, and cared for from day one. Visit payingitforwardsurrogacy.com to learn more. That's payingitforwardsurrogacy.com, because every journey to parenthood deserves heart, honesty, and the right support. Now let's get back to the episode.
The amount of
Yeah.
responsibility, like you said, and the amount of pressure that's put on a surrogate unbeknowingly to that surrogate prior to her getting everything and getting that positive pregnancy test. I think that's kind of when it hits, is once the meds are all done and then you get a positive pregnancy, you're like, okay, this has to work.
But it's like the pressure of also getting that positive pregnancy test.
Yeah.
And it's
For
not like
sure.
anybody's trying to put pressure on anybody. It's definitely
No.
not a
But it
purposeful
starts to
thing.
reap its ugly head.
Yeah.
Because the surrogates or the woman is going, oh my God, this all falls on me.
Mm-hmm.
We have to stop that.
Yeah.
It doesn't. It's a
Yeah.
village.
Even though we now know, right, like a lot of the placental problems that occur, like the even gestational diabetes or preeclampsia often have to do with the sperm.
Mm-hmm.
And so it has nothing to do with
us.
with what you're doing.
Right.
But still,
it's happening to you, and it's
Yeah.
somebody else's baby, and you're feeling like, oh my gosh, what could I have done differently? No, I'm right there. I felt that way every single one. Yep.
Yeah. And then, like you said, right, the meds don't even stop when you have that positive pregnancy test. With most clinics, you're supposed to keep going until 10, maybe 12 weeks. And sometimes you're caught off guard and you're like, I didn't realize. I mean, hopefully at some point somebody told you this was going to happen.
Right.
But sometimes that's way late in the process.
Yeah.
Once you're talking to the clinic, maybe even after legal, and now you're like, oh my goodness, I have to do this massive needle in my butt.
Yeah.
For another 3 months, or
right, whatever it is,
whatever it is, and I don't think that when you talk to your friends, I don't think they necessarily get in there like, okay, well, why are you doing this? Or
right, like you signed up for it. Like,
you signed up for this. Why are you gonna do this again? Or yeah.
Or why are you complaining? You're the one who wanted to be a surrogate. Like, oh my gosh.
Yeah, horrible. Yeah.
Especially when it comes from family and people who are close to you. You're like, you know what? I just need you to support me right now, not to.
Actually, that's a really good topic too that comes up, right? How do you navigate shifting dynamics with a partner or your in-laws or, your neighbors or your kids' teachers or, all of that, which it's nice when you can talk to somebody who you don't have to explain what happens.
Right. That's huge.
Yeah.
That's fantastic.
Yeah.
Wow.
Just to be heard and understood. That's a very big thing in surrogacy on both sides.
Yeah. No, it is. But to have somebody who already understands it, who already gets it, who's been there and has that knowledge rather than just, and I want to just say just a regular therapist, but a therapist that does not have that specialty.
Yeah.
It can make the difference in how many times you're going to a sessions, right? Like regular therapist, maybe you're going
the
10
tools in your toolbox.
Right.
That are given to
Exactly.
You. Yeah.
And how empathetic that individual can be towards you. That's a big one too, because if you don't get a connection and you don't feel like somebody's in your corner, you're not going to go back.
Yeah, for sure.
Wow.
Yeah.
It's very interesting.
Well, you're amazing, and what you do is amazing, and this is just say that word one more time. What's it called?
Perinatal mood and anxiety disorders. You're funny.
That's such a fun term. It's so long. It's not a great term, I know, but it's a fun one to say.
Yeah.
You were gonna say something, Mom?
Yeah. Was there like and maybe I already asked it and I forgot because now I'm old. Was there a specific, let's see. No. Did you come up with this, like, I want to support surrogates after you did your journey? Yes.
Yeah.
Okay.
Yeah.
Okay.
Because again, I think that the support that's available is good. I did feel supported. I think that agencies are pretty generous. I mean, I can't speak for all agencies, but specifically mine is pretty generous in the kinds of things they offer. They even have something where it's supposed to go a little bit deeper than the surface. that's like attended, like a social worker attends that, and that's nice.
Mm.
But that person isn't a surrogate or hasn't been a surrogate, and
Right.
so I feel like that shows somehow. And I don't mean to sound
You're not.
No, you're
judgier
not.
than
Not.
No, but it is
You're
true.
not.
It's different when you've actually walked
The
in the
walk.
same shoes.
Hmm. Yeah.
Yeah.
hmm
And it's
It's a
because
different
then
set of
you have,
circumstances.
yeah,
Hmm.
you have that perspective and you're like, oh, I've been there. I know what you're talking
Right.
about. Yeah, yeah,
Yeah,
yeah. Let
and
me tell
so it
you how to
really
deal with that.
was in response to
Okay.
that experience of
Okay.
feeling like, and seeing some of the things that people post in the group, and where I'm like, oh man, you so
Right.
need support, and I
Right.
wish I could just tell you to call me, but I
Oh.
can't.
Oh.
Right.
Um,
Oh
yeah.
God.
Well, hopefully people will hear this,
Yes.
and if they're not in those two states, they got to be able to reach out to their their support system, whether it's their agency, whether it's whatever, if they can't utilize your services. Um,
Yeah, I
but
mean,
support's
hopefully in
important.
the future there
Yeah.
are like Oregon is in the middle of trying to kind of pass a law where reciprocity is more of a thing, so that if
Oh,
you're
good.
licensed in one state, you can also work in other states, that kind of thing. Because we all pass the same board exam. It's
Exactly.
exactly the same board
No,
exam.
I know.
And
I know, and to
so,
have to do it in several states just to work there, it's
Nuts.
you guys
Yeah.
have already done the hour. My husband is in his master's program and coming up on his practicum to do all this for psychology, and you guys have to do so much. I can't imagine having to do that test twice or three times or four times or whatever.
yeah,
The
and usually it's not even that you have to retake it. It's just like you just pay a ton of money and go
Right.
through a lot of admin-y stuff, and it's just,
right.
Oh my gosh.
and
Yeah.
so it should just be
Annoying.
a lot easier. It's
Right.
annoying
Yeah,
to say
for
the
all the
least.
work that you guys go through
Yeah.
to get to where you are, you should
Yeah,
just be like, and same with lawyers. Once you've done it, you've done it. I get that the lawyer thing is different because there's laws and things
different
like
laws.
that, but
Yeah.
Yeah.
still,
And that is
thank
true
you.
for mental health too, right? Like
Yeah.
you have to have some awareness of the specific laws in the states that you work in, because like if somebody were to I don't know, threaten that they're going to harm someone, like
Hmm.
you need to
Right.
know the laws around,
What you
are you
do.
allowed to breach confidentiality? Can you warn the other person? That's different from state to state.
Right.
Is
Right.
it?
Yeah.
Yeah.
Oh, that's
Those are touchy.
interesting.
So
Because
I get that you can't just be like, oh, you live in one place and
Right.
you are good to go
Yeah.
in all the states, but it should be easier, and there should
It
be
should
some
be
it
some
easier.
should
process.
be. It should be
Yeah.
because then it could be more accessible
Well, I'm
to
glad
Yes.
people.
Oregon's working on it. Good for Oregon.
Yeah,
Yeah.
seriously, good for
Maybe
And
them.
they
so
can set a precedent.
eventually, I'll be able to offer this to
That'd be
to
lovely.
other
Yeah,
to
that'd be
surrogates in
That'd be
other
amazing.
states
great.
too.
That'd be
But
amazing.
It really
for
would, because
now,
I think if it could be, I think you'd be no, I don't think you'd be surprised, but you'd be inundated. Like you
yeah.
would. Like you
Yeah,
would. Like
a
there's a
lot of
need.
people.
There
Yeah.
is a need
Hmm.
for it. And I
Hmm.
just don't
Yeah.
think it's coming fast enough. So I applaud you for
Taking the
doing your
steps.
journey and then finding something to actually give back again.
Yeah.
You already gave back by helping somebody become a family, and now you're giving back again by helping the community. So I think it's
Yeah.
fantastic.
Oh my
And
gosh.
Thank
you're
you.
such a delight to talk to. So
I know.
I'm not pregnant, but I would come. I
Yep.
would.
Oh my
Thank
gosh.
you.
And so, if people want to reach out or anything like that, it's Oregon and Washington, right?
They can just go
Residents or
to my
people
website,
go to the
and then there's a
website.
contact form.
Okay.
Okay, perfect. And I will have that website in the show notes.
Yes, there's a contact form on there. I saw it. I was like, maybe I should fill this out. No, I should. No. Like, no, don't do
Yeah.
that. Don't do that.
Gosh.
I want to say one more thing, and that
Yeah.
is one of the differences is also like in a traditional therapy model, the clients or the patients don't know anything, or at least not that much about their therapist, right? That's sort of like the traditional
Right.
model where you don't really know
Mhm.
anything. And so in this, it's going to be slightly different, right? Like for
Yeah.
one, they do know that I'm a surrogate, and I think it's also more like it does have more of a coaching touch as well, even though it's not coaching, but
Right.
there can be a lot more
To learn.
well, here's what worked for me, or kind of more of a relational, like they'll know me as a person in addition to knowing me as a therapist, which is a main difference.
Yeah.
That is a big difference.
And it's a huge benefit to like,
I think so. Yeah.
You become more human
Mm-hmm.
in a patient's eyes. You become way more human.
Yeah.
And relatable.
Way more relatable. Right. Yeah.
Yeah.
Relatable. That's key.
Yeah.
Oh my gosh. Well, this was delightful. Thank you so much for reaching out. We really appreciate it.
We always ask, like, do you have any advice for a surrogate? It doesn't, if it's from your practice or from a surrogate side, it doesn't, whatever you want. But like one piece.
I think that every guest on your show says the same thing, but it's like, take your time and do your research. I actually, like, while I was, I had reached out and then they said, wait until you're done with your travels and then reach out again. During that time, I listened to all the podcasts, right? Like I listened to your podcast, I listened to other podcasts and got a lot of information, and feel like I was a lot more educated walking in.
Good.
Which really helped. And so I guess that's my advice. Just know what you're signing up for.
Yep.
Yeah. Try and find out what you don't know. Right? Because you don't know what you don't know. But there is enough information out there these days to give you at least a handful of knowledge.
Yeah.
If you take the time to research versus if you don't.
Right. Yes. Yeah. Exactly.
Yes.
But also don't be afraid to ask questions, right? Like if you are talking to an agency and they're just giving you all the nice, here's our benefits package and here's how this is going to work. Like ask, what do surrogates struggle with? Or tell me about a journey that didn't go well. And things like that, and see how they respond. And if they're like, oh, we never have issues, okay, that's probably a red flag.
Are you new? Did you start yesterday? Like,
yeah, exactly. So but then don't let that deter you either. Just like know how where you're going to get support and how are you going to navigate it. But if you want to do this, like you can do it.
You can. Yeah. You're living proof. Advice. Yes, you can. Yes, you can. Oh my gosh. Well, thank you. Yes. This has been nice. I got educated.
Yeah.
Same. Well, thanks for having me. This was a pleasure.
Oh my gosh. And good luck to you. I hope everybody hears this and everybody lives in Oregon and Washington. And then you're just like, you don't know what to do with all the people.
Yes, let's just have people move to Oregon.
Just move there, guys. Just move there.
Exactly.
Well, amazing. Thank you so much. Definitely keep us posted if you start working with an agency and stuff, because I think that's going to be a big pull for a lot of people to know that they would have that extra bonus of support.
Yes. Yeah, I will stay
Come back and do a follow-up. Yeah.
Yeah.
We're always up for follow-ups.
Yes. Awesome. Amazing. Okay. Well, thank you so much. Have a wonderful evening.
Thank you. You too.
Jana.
Bye. Bye, you both.
Bye. Wow.
That's super interesting.
Can you say the term? Do you know how to say it? Ooh, you're gonna butcher it.
Perinatal modem anxiety disorder?
I don't know. I'll have to listen back.
Look that up. Let me look that up right now.
But anyways, that was so amazing. Thank you so much, Jana. This was very beneficial. I think that this should be like almost standard. I mean, I get the whole like, okay, yes, like, because you do a psych eval, which is very different than this, absolutely, because the psych eval happens first. You're like, yes, you need that, and absolutely, let's do that 100%. But during your journey, when you are seeking out that, I know several girls that are like, oh, I went and talked to a therapist, and it's like, maybe this was the type of therapist that you needed to talk to, like this specialty. This is what's going to help. This is
I think
the core.
What she does is fills that tiny little slice of. Talk to somebody who's been a surrogate, talk to somebody who's walked the walk, who has the clinical knowledge, who actually had some things go with her that now she has relevant experience with, and who's very present in the community all over. Because she doesn't just specialize in this, she specializes in the perinatal aspect of it with depression and all of that. I really think she's got a little niche right there
I
where
think so too.
it's,
And
yeah,
I think it's going to be very beneficial
I
and
do too.
very,
Got to get that word out. Yeah,
yeah.
be
Absolutely.
lovely.
Well, thank you so much, Jana.
Yeah.
If anybody has any questions or stories they would like to share, please feel free to reach out to us on Instagram at Stop.Sit.Surrogate, or you guys can email us at Stop.Sit.Surrogate@gmail.com. And this has been another episode of Stop.Sit.Surrogate with Kennedy and Ellen.
Bye, everybody.
Bye.
Before we wrap up, we want to give a huge thank you to our sponsors: Northwest Surrogacy Center, New York Surrogacy Center, Paying It Forward Surrogacy, and Serene Surrogacy Partners. Their continued support helps us share real stories, educate our community, and connect families through the incredible journey of surrogacy. Thanks so much for tuning in to Stop.Sit.Surrogate, where every story matters and every journey is worth sharing. We'll see you next time.
If you enjoyed this podcast, be sure to give us a like and subscribe. Also, check out the link to our YouTube channel in the description. And be sure to also check out our children's book, My Mom Has Superpowers, sold on Amazon and Etsy.